So to diagnose hip osteoarthritis, it's a combination of listening to your patient's symptoms, which as I've already discussed are usually morning stiffness within the hip joint and difficulty with activities such as putting on shoes and socks. And then also combining that with your objective examination. So in the objective examination, we'll normally find a restriction in hip mobility. Commonly, when you take the hip up into flexion, they will deviate laterally and have some restriction into flexion. They'll also have a loss of rotation. So when you take the hip into external and internal rotation, you'll find a reduction in movement. And they can also have a reduction in movement into abductional fibers, which is also a classic sign of your osteoarthritic hip. So once you've listened to the subjective examination and they have signs of stiffness or symptoms of stiffness in their reported history, as well as a restriction in rotational flexion range of movement, you've got a more clear picture that they have underlying osteoarthritic changes. You can also get an X-ray to help back up your diagnosis, and of course on an X-ray what you'll find is a loss of joint space or osteophytes on either the femoral or the acetabular surface of the hip joint.